Fortified City TV presents Health Matters. We bring you education and awareness on your health, the total person, your spiritual health, your physical health, and your financial health. Please join us, faith leaders, professionals, and community leaders, this Thursday and every Thursday at 6 p.m. CST or 11 p.m. GMT for a life-changing encounter. Your health matters.
This place right now. Believe it. Believe it. Believe it. Believe it. Hello and welcome again to another edition of Health Matters. It is a presentation by the Fortified City International Ministries here in Minnesota. Tonight, we will be discussing the topic malnutrition. And this promised to be another interesting edition. So stay tuned, share the podcast, and invite as many as you can, especially those that are connected with people in Africa, and to be specific, West Africa and Liberia. So share the video. Thanks for joining us. And tonight we have with us that will be bringing to you all the health education on malnutrition, not all, but most of the basic things that you need to know about malnutrition. We have with us tonight one of our contributors on Health Matters. This is Abby Tyler. Abby, you are welcome.
Thanks for having me.
And Abby will introduce herself. And right after that, we'll go into the seasonal health tips before we go into our program for tonight. Malnutrition. Abby, can you just remind our viewers again who you are?
Hi, viewers. I haven't been here for a while. Thanks for having me back. My name is Abby Tyler. I am a family nurse practitioner. Prior to that, I was a registered nurse for 22 years. I worked on the cardiac floor. I work in the city of Philadelphia, live in Pennsylvania, and I also host Abby Tyler's Healthy Living. It's right back there. So if you're interested, you can, I have a page. You can go in there and join. And I contribute to different health things in my community. I am married and mother of two, and I'm happy to be here to contribute.
Thank you so very much, Abby. It is a pleasure having you again. We are grateful to be, in this circle again, providing information and education. So we are thankful. So just to go into our program tonight, I have a brief information for us. And we are still in the season. We are still celebrating. I want to read a holiday reminder from the Department of Health in Minnesota. And it reads, one, you should get vaccinated. Minnesotans age 5 and up can be vaccinated. So if you are in Minnesota from age 5 and up, and as many that are, that fall within this range, if you are in other states, I'm sure there are information available on your state website and also the CDC website. So go there and get all the information that you need to get. We are not out of the woods yet. There's so much going on that we need to be updated weekly as it concerns this coronavirus and all the different strains and that is surfacing. So number one, get vaccinated. Minnesotans age 5 and up can be vaccinated. Vaccines are the best way to protect yourself and your loved ones, especially those who can't be vaccinated, like children that are under 5, they cannot be vaccinated. So you need to be vaccinated so you cannot make them sick. Two, get your booster shots. All Minnesotans 16 and older should get a booster when they are due, 6 months after receiving your Pfizer and your Moderna, and 2 months after receiving Johnson and Johnson. Three, get tested. Even if you are not experiencing symptoms, test before gathering to make sure you are not spreading the virus to others unknowingly. It means that if you are going to a huge gathering, maybe you are traveling, maybe you are going for a party, anywhere you are going to be in a large gathering, you need to get tested before you go so that you will not spread the virus amongst the other people. So the last one, stay safe, wear a well-fitting mask when traveling and when indoor, public settings. Like you are going to a grocery store, you are going to the shopping mall, you are in the school, whatever is public, and you are going, wear your mask. Wash your hands as often as you can. And, do the best you can to avoid, touching all the crowded doors and all the kinds of stuff. If you do, make sure you have your hand sanitizer with you so that you can always, use it. So this is just a health tips from the Department of Health, Minnesota. And I show this information is also, is across, like it goes to the rest of the states. So wherever you are, coronavirus is serious and you need to take it serious. You need to stay safe, keep yourself and your family safe. So thank you. That was a little tip. So as you are enjoying and traveling up and down during this holiday, you can remain safe, you can remain healthy, and you can also keep your family and your community safe. Now we want to come to our discussion for tonight. We will be talking about malnutrition. And our healthcare practitioner tonight is Mrs. Abby Tyler, and she's going to be telling us. The first thing we need to know, Abby, we want to tell our people, the topic itself, malnutrition. What is it?
Well, before I start, let me give my disclaimer. Also, whatever I say here and whatever we talk about, these are from reputable sites, and from my training as nurse and nurse practitioner as well. But as always, we tell you whatever changes, do not make any changes to your regimen without first speaking to your own provider. So, with that being said, I'll start. I'm gonna put on my glasses because once
Go
again,
ahead.
if you have diabetes and hypertension, make sure you're seeing your doctor, getting your eyes checked, and at least getting your eyes checked regardless once a year. Okay, so just putting that out there. Okay, so malnutrition refers to when a person's diet does not provide enough nutrients or the right balance for optimal health. So meaning you're supposed to be getting a certain amount of caloric intake every day, and if you're not eating that much to sustain you, that's when you go into malnutrition and you start having other problems with that. So you're not eating enough food to keep you to sustain you, basically.
So, is it only not eating enough food or
Not eating it's not so much not eating enough food, but you're not eating enough nutrients, the right kind of food in the
okay,
right amount to sustain your
to
body,
have a
because your
balance?
body, yes, you have to have a well balanced diet, your proteins, the carbohydrates, everything, your fats and all that, in order for you to be able to function properly.
So, what are the symptoms? What are some of the symptoms, one should watch out for if, if you think the person or, that looks like something or someone that is malnourished? What are those symptoms?
So if the person was in the hospital, or if I'm seeing a patient at my in my office, I'll be looking at the patient saying they're not physically. I'm going to be looking at them to see when they stand on the scale. We're going to weigh them because we look at the BMI, and the healthy BMI is between 19 and 25. So anything that's lower than 19, that's when we start saying that's unsafe. So usually we'll start asking them questions. So we'll look for a lack of appetite or just no interest in eating. Usually that, if you don't have any appetite and no interest in eating, that will lead to malnutrition. You're very tired, you're very, you're just sitting there and you're irritable, like you're moving around, you're jerking around a lot. That usually will signal that inability to concentrate. Sometimes the teachers might tell you this child, when they're in school, they're probably lethargic, meaning they're sleepy, or they're moving around, they can concentrate. I can't get them to sit down one place to really be able to, and I ask them questions. They're not really functioning, they're not spaced, they're not right there when I'm asking them questions, so they seem to be spacing out. Always feeling cold, because when you don't have enough nutrients and enough, like I said, carbohydrates and everything to keep you warm, you're gonna be cold all the time because your body doesn't have enough there to work with. Depression. I mean, when you're sitting there and you're laying back and you don't feel like doing anything. You don't find pleasure in doing day-to-day activities. The thing you used to find pleasure before, because when we start defining depression, we go into like, do you have any problems finding pleasure, any things you used to do before? I don't like going to school. I don't like going, or my friends want to go out. I don't want to go out. I want to stay home. I don't want to do this. I don't want to do that. So those are the kind of things that we start looking for. We'll look at your body muscle again. Like I said, your body weight, your BMI should be between 19 and 25. Over 25 is like when you start going clinically overweight. But when we're looking at your body, when we're feeling to see if you're dehydrated, if I'm squeezing you and you're not plump, like I'm feeling your skin like that, it should be able to just fall back. And if it's just like there and you can see very paper thin skin, that's also a signal there. Loss of body fat, body tissue. If you're always sick too, because again, you don't have the nutrients in order to keep you healthy, to fight. Your immune system is not healthy enough, so you're always going to be sick. If you're sick, it takes you a longer time to get well, especially, let's say, if you cut yourself somewhere. If you have a cold, you seem to be sick most of the time and more frequently, if for a longer period of time. And again, wound healing and also complications after surgery. That's why mostly when people who have like diabetes and other things, and if the doctor looks at you, your provider looks at you and fine and look at your weight and they do everything else in your blood work and they see there's something going on there, they'll probably postpone the surgery unless if it's absolutely necessary. And then after the surgery, if you need any kind of supplemental feedings, then we'll go on from there.
Wow, that's a lot.
Yes.
Hopefully, our viewers will pass this information on.
And
So
in developing countries, of course,
yes,
you'll
yes,
look at the child, you'll see their eyes, they're like kind of dry. Usually their mouth, usually your
dry
lips and
on the
everything are supposed to
lips.
be nice and moist. There will be really dry. Their fingernails will be brittle, and the chest will be like real skinny, and the stomach will be a little more enlarged. The legs will be much smaller for their bodies. There will be a little undergrowth, like you see a 5-year-old that's supposed to look like they're 5 years old, compared to not so much Western, but compared to other 5-year-olds in that society. And they're much smaller. They appear much smaller than what the 5-year-old is supposed to be.
That is so true. I traveled to Liberia last month, and I came across some little kids, and you know, I decided to ask them some questions. I asked them how old they were. I asked what grade they were in. Those are little questions. And when they told me their ages, I was kind of shocked because you will see their size. That's what prompted this whole discussion, because when I saw the size of the little boy and the size of the little girl and the age they gave me, I said, "Oh my goodness, you mean you are 8 years old and he looks like a 5-year old, you know?" And he was not the only person. It was like a couple of them that I met. They was like that. So this malnutrition, it just hindered like you rightly said, it hinders the growth process. So this is something in the developing world, especially in Liberia, who is now on record for malnutrition. I mean, this is something we need to you know, to hear, and we need to spread the word, pass the word on, and especially when it comes to how we can help ourselves, you know. And I'm glad that you took up the time to be able to talk to us. So the next question that I have here is what are what are some of the cause for this, the causes?
Some of the causes of malnutrition, because some people have developed malnutrition because there's not enough available food, like we just talked about, and
Mm-hmm.
not healthy food. Because in developing countries, most people have maybe they'll eat like for breakfast, and most children don't. When they go to school, they don't have enough money to buy food to eat at lunch, so they don't eat at lunch. That's why in America, yeah, that's also a problem, and most family members cannot afford to have a substantial amount of lunch. That's why the American schools have free lunch, free breakfast, and free lunch. And most of these kids, it continues into the summer months too, because otherwise these kids will go hungry. Their parents cannot afford all that. So that's so when there's not enough food in Liberia, or there's not enough food for the parents to afford, they eat their breakfast and then they eat their dinner, and that's it. So it's usually like rice and the soup. So they're not having like a cup of milk, because you need your calcium, you need iron from the milk and all to keep you going. So some of the causes, that, like I said, this can be a result. I'm going to turn this off for a little bit here. Result of I'm not going to go into the medical part now. If you
Yeah.
have any kind of cancer issues going on, if you have any kind of liver disease, all of that, it breaks you down and you may not want to eat. And conditions that may cause nausea, which is also you can have that from cancer, or any kind of stomach issues. Difficulty swallowing. If you have problems swallowing, you can have issues with that. Some people who have problems with their teeth. If you can't chew, you're not going to be able to eat the kind of food that you're supposed to be eating.
That's
If you
right.
have any, if you're taking any medications that may also affect your stomach, that may affect your ability to eat, or also your desire to eat. That can, and also going back to depression too, because if you're depressed, you're not going to want to eat. If you go into any kind of family issues or any kind of abuse or all of that, you not want to eat. And some people, that they could say, okay, they see, especially when you live in somewhere poor, you may not want to eat because you're so used to not eating at a certain time, so you just save your food. I remember that took me back to when I was in Liberia when I was very young. We went to this house. My mom took me to this house, and all these kids, they were cooking, and the
Mm.
family members were cooking, and they had all these kids were supposed to be eating, and the food they were supposed to be eating, because that's when all the little kids ate together.
Yeah.
And I was sitting there. I remember I was 7 years old. I remember it clearly. And they called me to eat. And in Liberia, when they call you to eat, if you don't eat, that's like an insult. So I was sitting there, and at that very young age, I kept saying to myself, I said, if I go and eat with them, they're not going to have enough, because you could tell that. I mean, they were eating so fast, and yeah, and even when we're younger too, when we ate together, we ate so fast, but they ate so fast, and they still looked kind of hungry, and I didn't want to eat. I kept saying, no, I have food at my house. I don't want to eat. And I remember when I got home, my mother was really upset. She thought I embarrassed her and all that too, and I got a spanking for it. But even then, I knew the importance of the fact that some children don't have enough. Like I have at home, I can have my whole bowl of rice. They don't
Yeah,
have that.
they do
So
not.
a lot of people don't have the privilege. They don't have not so much privilege, but their parents cannot afford it. And in Liberia, where this poverty is like rampant, so that could be one of the main reasons poverty.
Hmm.
Okay, and like I went to the mouth and ill-fitting dentures and all, but mostly in developing countries, mainly because of poverty. All right. And mental conditions that, like, once again, if you're depressed, if you have any kind of issues, and we also have eating disorders among Liberian people over here too. I know when we talk about eating disorders, people are like, okay, you're in developing country, the food is there and you're not eating, but anorexia and and bulimia, those are all mental issues. So you think you're too fat, because especially now with young girls who are growing up here, you
Yeah.
tell them they're fat, and then it's like they're watching TikTok and watching this, and they see people on there, and they design these unrealistic goals about this is how I'm supposed to look. So they start putting their fingers on their throat and vomiting, which can cause some severe heart problems and teeth and all that. Or also they eat a whole lot and then they vomit the food, or decide they're not going to eat, because that way they'll stay skinny. So those are some of the causes of which is a social mobility problem. If the people live alone, especially for adult elderly, if they can't
Yeah.
afford to go to the store to buy their foods, They're not physically fit to prepare the meals, and even people who live alone. So sometimes they're like, I live alone, I don't want to eat, I don't want to, I want to cook if somebody could cook for me. So that's one of the main reasons over here too, for elderly people and people who are sick, we have the program called Meals on Wheels, where they can prepare the food and take it to the older people or people who are sick in the neighborhood, and at
Yeah.
least they have something to eat, healthy meals to eat.
Hmm. Wow.
So if Liberia could develop a program where at least the children get free breakfast and
Yeah,
free lunch,
it's true.
and then the family can just concentrate on dinner, that
Yeah.
would be, that would really go a long way in helping children getting the right nutrients so they
Mhm.
can live happily, live healthier, and be able to compete with other Liberians and also the competitors in African countries as well as developing countries.
Definitely. Yeah, hopefully that can happen. Really. So, what are some of the risk factors?
Okay, some of those risk factors of that. Let me just change my page here. Some of the risk factors when you in some part of the world, widespread and long-term malnutrition can result from lack of food. So in wealthy nations is different, but older adults, especially when they're in a hospital, long-term institutional care, but over here you have nutritionists and these older adults who are in long-term care, they're being weighed just about every month. So we're taking, we keep an eye on them all the time. People who are socially isolated, that can
Yeah.
cause a problem. For example, like I said, due to mobility issues, health issues, people with low income, that when you don't have enough money, you can afford to buy the food. People recovering from serious illness that can cause that. People developing chronic eating disorder, like I said again, bulimia and anorexia, and some people may have to take different have to take supplements like Lucerna and Ensure and other things that it can take to supplement the food they're eating. But that when you're medically sick and
Yeah.
other reasons. But the risk factors is when you don't have enough food, you cannot concentrate. Once again, I say your carbohydrates, your iron, your nutrients, your proteins, and all you need that. In developing countries, you need that. So if you're not getting that, we go back to the point again, you won't be able to function properly, especially with children. You know, they can you can't do that much because that phrase that say empty bag can't stand.
I know, right?
Yeah. So, if you're sitting there and you just get one piece of donut or one piece of little weasel, like donut or round bread or something like that, and they're supposed to be eating, that little cornmeal in the morning or cream of wheat and have like a bowl of fruit or just, one apple and a glass of milk or a glass of orange juice. That should be enough for the morning. And then lunchtime, they have something healthy. And then also lunch, and in the case of Liberia, not so much healthy, but at least just enough different kind of food, the well balanced diet in order for them to be able to concentrate and perform effectively.
Hmm. What about diagnosis? How is it done?
Like I said, when we do the diagnosis, it all depends on the setting too. If you were in a hospital, let's say they brought you into the hospital, you were so we'll call that failure to thrive. Because if you stop eating for a while and then we're admitted into the hospital, then we're going to go through the many reasons on why you're not eating. Is there something going on? Are you having dementia? Are you having any kind of illnesses that's causing you not to eat? Once again, your teeth and all. So we'll look at that. We'll do blood work and all and see what all your different your electrolytes, look and see if your kidney functioning. 'Cause when we see those numbers, then we can say, okay, you're dehydrated, and then we start going through the social causes and saying, okay, who lives at home with you, who's preparing your food for you, do you have enough food, family members, social gatherings or social services in the area. And we based on that, based on your weight, again, go back to your BMI, where you're supposed to be between 19 and 25. And for elderly people, it's not necessarily going to be between 19 and 25, but at least close to that or a little bit higher than that. And we're looking at the skin to see if it's not very pale. For Black people, you're going to look into the eyes and see the coloring, and the hands, you want to make sure it's not like white, is you have some blood return when you press on there. And we do different things. Like I said, you're talking about the clinical scale now.
Yeah.
We want to make sure the person has had any food over 5 days or so. We're going to be adding up the score and see, and the doctor and compare all the different rates. And if you came to my office, of course, I'll do your weight first, and then I'll go through these same questions again because you'd be in a primary care setting, and then I go through asking you the same questions because by this time, and I'm looking at you while you're sitting next to me, and I'm looking at you. I'm looking to see if you're sitting up, when I walked in the room? Are you sitting up? Are you answering my questions the way it's supposed to be? Are you, when I ask you about things that are happening currently, are you focused on what I'm saying? Do you, like, first question I'm going to ask you, everybody knows who the president is. So I'm going to ask you, who's the president? What's your full name, your date of birth? What city are we in? Tell me something current, or I will say something and for you to, because so all of that, when you're not getting your complete stuff, you cannot concentrate and you cannot be in the present, put it that way. So right away, I'm going to start looking at that and I'll start marking things down and going from there. And just by looking at you, I can also tell, are you, when you lay, are you laying back in the chair? When I tell you sit up, breathe in and let me listen to your heart. Let me look at, I'm looking at your lungs, looking at your chest area, looking at your stomach, make sure it's not distended and not hard. And you just don't look very fatigued. Like you weren't sick, but you don't look, you're not looking yourself. People like somebody look at you and say, that person not looking like such to do, so stuff like that. I'll be looking at that and be asking questions about how many meals you're eating per day. So the different factors. I didn't want to go too far into the clinical part and just the basic stuff to say how we're going to diagnose that.
So when a doctor diagnoses malnutrition, how is it treated?
Well, because most of it will be the underlying. In order to treat it, you want to find the underlying reasons. So if the person is malnourished, when let's say the person, when they come in and they're staying on the scale and they're less than 19, I'm looking at them. I'm also looking at the race, because certain races, people are small framed. So for that race, I may say, okay, you're very small frame, and that's okay. For other people, other races, they're different, but you're still looking at it 19 to 25. It's not like, solid 19 to 25. There's the other factors that go into the BMI.
Yeah.
So when you have to identify the underlying factors. If it's depression, you want to make sure you take care of depression, because we have social services in the area that you can contact and make sure if the person needs to be, if it's an elderly person, the person may need to go to an adult daycare. If it's a teenagers that are going through and eating disorders, you may want to send them to see a therapist. And I usually tell people, sometimes they say, I don't feel like eating and this and that. I say, eat small meals, eat frequent small meals during the day. Because some people, when they sit down and see all of that in front of them, they don't want to eat. And you also want to make sure if the person is going through anything, recent, like recent death, recent divorce, recent separation, recent trauma, anything, especially like we had the hurricanes and you have fires over there, you have deaths, and also you want to make sure you take care of the underlying factor first. And then you go on from there. If the person is not taking in any food at all, and the person, you're looking at the vital signs and they seem medically sick, that you can't just send them home, then you send them to the hospital, because they may need IV food and IV fluids and other things, and to take care of all of that. Because eventually, when they become too dehydrated, that affects their heart, also affects the liver, and affects the kidneys, and all of that may shut down if it's not addressed in a timely fashion.
Wow. Hopefully, we can address this. So how is it? How is it prevented? How can we prevent this?
But I mean, pretty much prevent. Sorry, this is making noise.
Mhm.
The prevention. You want to make sure, like I said, in developing nations, and most of these things, when I talk about healthcare, when I talk about comprehensive healthcare in Liberia, it's not just one ministry that takes care of it. You need a multidisciplinary approach, like the Ministry of Health and the Ministry of Education, and they can combine, and also have social services, because most important, like I said, children, you should have little when they go to school in Liberia, at least try to find a way where the government can put things together where children can have free breakfast. Okay, they can have free breakfast, they can have free lunch, even if it's just lunch. Okay, it's just say lunch, because they may not be able to get there on time to have free breakfast. For free lunch, one healthy meal a day. And then also you teaching them, you say, remember back when we used to eat our rice, but we used to be eating plum, we ate
Yeah,
guava, we ate everything else. So
all kinds
all
of
those
fruits.
things that were all part of a healthy diet, so and we didn't drink that much milk. I don't remember drinking that much milk there. Just only there was the milk for the babies and the little kids. But and I remember one time they had some program where institution or some charity was handing out cartons of milk, so they can do that. The government can. I mean, there's so many things they're wasting money on, and they're getting money from different places, from donors. You can get different NGOs to do that. Okay, if you can't do it in the schools, even in the community centers, get community centers in these different cities, and
Mhm.
have food there where the kids can go there and eat. If it is one healthy meal a day, and then the parents can pick that, because most of the parents, they're working so hard. They can't afford to have healthy meals for their kids all the time. So the government needs to step in, and other charity organizations need to step in and supplement whatever it is the government cannot do. But the government needs to be the first person in line, Ministry of Health, Ministry of Education, to get together and form different programs to do that.
Yeah, let me take a question here from this person. They want to know, how long does it take to recover from malnutrition?
That depends on where you were, what your status were when you was diagnosed. Okay, so if you were really medically sick, you were in the hospital, they're going to be doing your blood work every day to see what your numbers are. We're going to be looking at you to see if you're not dehydrated. Like I said, looking at the skin to make sure you're not too dry, looking your eyes and make sure your eyes is nice and moist, and your lips and everything. So be looking at that. So that depends on where you are when you're diagnosed, and also is getting you on the scale, making sure you're getting that scale, and that scale is your numbers are going up, but you're gaining the weight healthily. You're not gaining the weight just a big belly and then skinny shoulders and skinny chest. So we're looking at the full body. So it depends on where you are when you were diagnosed.
Okay, thank you. What about, he's asking, can this cause back pain?
Yeah, because if you're not eating, you're not getting your proteins, your carbohydrates, your milk and all, especially for your milk, your vitamin D, that your bones, if your bones are not being nourished every time, that will cause
Yeah,
skeletal pain, which will eventually cause back pain, because even your bones and everything will start hurting you. And once again, like I say, you're very cold, so you're not. And when you're cold, your bones are cold too. So you need that vitamin D, you need your milk, you need your calcium, all of that in order to keep your bones healthy. So it will cause you back pain, because your back is the one that supports your body. So if
yeah,
you're not getting there, you're gonna be it's going to cause
yeah.
back pain, knee pain, and everything. That's why as women, as we get older, because the body is not making that much calcium anymore, we need to have calcium supplements.
And this person want to know, are there many types of malnutrition?
I mean, from the ones that we discussed and all, like I said, malnutrition because of other reasons.
Yeah,
So other causes mean caused by anorexia nervosa, bulimia, an inability to eat, not enough food. So knowing the cause of the malnutrition, knowing the type of malnutrition because the cause of it, that's when you know what it's all about. It's my cousin right there who
yeah.
actually talked about it.
She say hello. So hello to you too, Jackie.
She keeps me in check. She's like, make sure you don't talk too fast. Make
Oh,
sure. So
thank you for joining us. But there's this, the situation in Liberia. What local things can we use? Can the mothers use, to help the children, or maybe the young adults, like those little girls that are giving birth to babies? What can they do?
well, if they, especially the young girls, that's when I start talking about, you wouldn't make sure they don't get pregnant. So in order to do that, that's when you're
They're
gonna start
already
having
pregnant.
okay. Mainly, make sure the girls are getting enough nutrients in order for them, if they're gonna be breastfeeding their babies, because they tell you breastfeeding is the most important part. So you want to do that, and not everybody can breastfeed. I don't want to make anybody feel guilty that because sometimes the baby doesn't latch on, or the if especially if she's really young, she's not going to be want to be breastfeeding. But if she can go ahead and do that, making sure the babies have formulas, again, the social service department in the hospitals can work on that. The babies can have low cost formula. They have so many formulas out there that's low cost, especially if you have a charity organization where you can go to get formula from the hospital or these organizations. Make sure they're drinking. The babies cannot have regular milk until age 1. So nobody's be drinking regular milk until age 1. But after that, then that's when they can start having regular milk, spinach. Would be potato greens for them? Yeah.
Yeah.
Okay. Because I'll leave making sure they're getting enough water, they're going out and getting enough sunshine, so they get enough natural vitamin D. For if they're in the hospital, pediatricians can give them like vitamins, children vitamins, to help along the way. If they're sick, I usually kind of to keep them hydrated and get their electrolytes okay, I say go for Gatorade. But I'm not too much into Liberian healthcare stuff, so I'm still learning along the way. But those will be the things. When we were growing up, it was mainly you getting your rice, you had a full bowl of rice, enough for a child to grow up. You had your fruits. We had all these foods that we ate all the time. We had enough water to drink, and we didn't drink that much soda, so that was kind of healthy for us. Even though when you get
Yeah,
older, that's what you want to drink, and playing, and just making sure the child is going to the doctors. Over here, you go to a pediatrician every year or as often as you're supposed to. Over there, that's not the case. So even if they're malnourished or something's going on with them, they won't know because the blood work is not being done. They're not being seen by a pediatrician. And if something happens and they get sick, then we just say that's witchcraft or God's will.
I
So
know, right?
help if it would
Yeah,
help if they had pediatricians, or people, doctors, general practitioners that were there to take care of little kids, to see them every year and then going from there. And social service also, like I said, it has to take a multidisciplinary approach to fight malnutrition in Liberia. It can't just be one group. It has to be all of it. The same way
yes,
in
yeah,
America here.
yeah. Most of the time, this is the reason why health matters is here is because we want to provide education and information. It's good to be aware. And most of the time, when we come here, we give the condition, the symptoms attached to them, and the way forward that you need to see a healthcare practitioner so you can be able to properly, you know, be taken care of. Most of the time, Africans, especially Africans, those in Africa, they just see people sick and they conclude that witchcraft. Some people are malnourished, but they'll say, oh, the dragon sucking the person's blood. You're not eating the right nutrients, not getting the right nutrients. Of course, you will not be healthy. So this program is to provide the information that you need so you can be healthy, so you can see doctor when you need to see the doctor, so you can stop taking medication all by yourself. Or by the time your head is aching, you go to the drugstore. And these drugstores, they need to be regulated because they just give drugs, any kind of drug you want. No regulation.
Even back there when I was there one time, I remember I said, or in Johnsonville, my cousins over there, and they were taking our little cousin to the clinic, the local clinic, and my aunt didn't come with us. It was me. I think I was about maybe 10 or 11, and my cousin must have been about the same age. And my youngest cousin, the one we were taking to the clinic, she was about 4, and we took her, and I think she got a shot and everything, and then and I'm thinking to myself, as I was growing up and then coming, of age over here, I said, there's no way a pediatric patient should be taking another pediatric patient. A minor should be taking a pediatric patient to see the doctors. There's no way. I mean, what are they writing in the notes when you sitting there and the person who brought this 4-year-old is a 10 or 11-year-old?
Can you imagine?
So there's no regulation. There shouldn't be any reason that should be that way.
Yeah.
And people say, okay, well, it's different, and especially now when you have access, and all these people who are running the country back there, they
But
have access to all this
right,
information over here.
right now, you have 60 years old giving birth. So who's going to take that baby? The person is 15. They already have a baby. So it's a minor taking another minor to the
Yeah.
hospital.
Mhm.
So the situation is just something else. And
And to prevent, the child, that 16-year-old is going to have a hard time raising that baby, because especially if she was already in poverty and raised by and then had a baby, and so having to raise this baby, and the grandmother will have to take care of this 16-year-old and the baby, because the father's not going to be too involved. So you want to make sure, in order to make sure that doesn't happen, it's when to start speaking to teenagers about pregnancy, boys and girls, by the way. It's not just because, we come from a society where teenage girls pregnancy, and the boys, it's like the girl's getting pregnant on her own. So you want to make sure you want to speak about, development, puberty, and how to protect yourself from getting pregnant. You always want to talk about abstinence, but we have to also realize that we live in a real world, and if that child's going to have sex before they get married or at a responsible age, you want to make sure they know how to protect themselves, because it's not just pregnancy, it's also diseases. And also you want to make sure we have to have that conversation in all of it, encompassing everything, all of healthcare. So there's so much to talk about when it comes to
yeah,
healthcare in Liberia, but people
yeah.
don't, it's like it's not one thing that takes priority when it comes to these discussions. So
And another thing that the young mothers need to know, they have these babies, and then because of the condition, the living condition, the poverty, that is so rampant. You have mothers, they have this baby and they don't give them the right food. Like they give them pap. Pap is all carbohydrate. And then after giving pap, you get rice, you squeeze the rice again and give it to the child. I mean, everything they have is carbohydrate. Nothing is balanced to help that child get the right nutrients.
So
So
I think at the clinic where they're having these babies, I mean, you could easily have like a big sign on the wall so that they can see it and know what to give the babies. You
I
know, they
mean,
should have,
I mean,
but
please, we here we're talking about Africa, especially Liberia. Signs on the wall? No, you
maybe
have to
just
talk.
something. Because I remember my mom used to run what's it called, family planning,
Even if they
family
have
planning.
it, they're not going to
Yeah,
read it. So
you
we,
know.
we
But
have
then
to keep saying it. Keep
yes.
saying it.
So
So this,
while they're pregnant and all this, you have somebody who is teaching them, but then also teenage pregnancy is still taboo back there too. So the girl's probably not being hanging out with other people or being seen as somebody who's accepted because oh my gosh, she's pregnant. So we don't want her. I remember police to say, oh, I don't want this person around my daughter if they're pregnant because I don't want to teach my daughter anything.
that,
So
that is
they're
no
pregnant.
longer the case.
Yeah.
That's
So
why
yeah,
you have a lot of teenage pregnancy.
and that
Teenage pregnancy has increased, especially in our nation. So,
and it's not always from and they're not being pregnant by teenage boys. It's mostly older men.
well, we'll find out.
Because I mean, really, if the girls are like, most of the time there, and I have family and friends who live there, and it's like you have to make ends meet, and these girls are having to
Yeah,
date
that's right.
older men to make ends meet. And if you're a mother of a teenage daughter, she's not gonna be messing around with some teenage boy who cannot do anything for her. She's
I
probably gonna
know,
be
right?
messing around,
So they are being violated. I mean,
exploited,
it's
basically.
yeah,
It's
yeah.
sad.
So I mean, we just got to keep saying this thing. And you find out those girls, they get pregnant, give birth, and maybe you might not even see the guy again because he don't want to be identified with the girl and he don't want his wife to know or something like that. At the end of the day, she starts struggling. So a lot need, a lot need to be done, you know. But we just want to pass this information across today. We are talking about malnutrition. If a teenager is pregnant, eat the right food so you can have a very healthy baby. They got potato greens, they got cassava leaf, they bunny there. Bunny. That bunny is okay.
Eat a lot of fish too,
They
because at
fish.
that point you have to have your caloric intake has to be a little higher than somebody who's trying to stay skinny.
Yes.
You're eating for you and the baby, so you want to make
Yes.
sure you have, you're taking a lot of you eat a lot of fish and mostly seafood and right.
Yeah.
Don't overdo it too because you still want to have a healthy baby and you don't want to have a baby that you don't want to have gestational diabetes either, or a baby that's born really overweight and have problems with diabetes. So you also want to eat that. And I don't know if they have prenatal vitamins over there. It's
They
important for.
do. They do.
Can they afford it now?
Yeah. Oh my God. But anyway, when you eat right, the baby will be okay. And not only that, when you have the baby, the food you give the baby, let the thing be balanced. I remember some time ago that people used to have the rice dust. Okay, you have the rice dust and you have the sesame seed, which we call the banana seed. And people used to even add like peanuts and pound it and grind it and mix it up, fix something apart and give it to the child just because they wanted a little bit of protein and a little bit of carbohydrate. So they can only have only the carbohydrate. So it looks like, for the kind of increase that we are seeing, look like people are not really doing the things they used to do, especially the younger ones. They're not really doing what the older ones used to do at that time. So we need to go back to the basics. We need to go back to passing on information, giving people education on the little local things that we have that they can use, things that are easily available. So this is just a message for all the young girls that are getting pregnant, and even the mothers that are, unable, or families that are unable to take care of the children the proper way. You don't have to buy meat. Just make sure they have lebuni, and make sure ground pea is there. Sometimes you fix groundnut soup. They're eating rice, no meat. There be groundnut soup.
In Liberia, with the fish was cheaper, right? Because we ate a lot more fish. We ate chicken. We ate chicken on special days, like the big white
Yeah.
chicken on special
So
days. But fish was easily available there, so it was cheaper. It was cheaper, so they can eat that.
hopefully they can get the money to buy the fish, because when you're not working and there's no stable income, it's kind of difficult. So whatever little,
That all goes
yeah,
back to where government needs to start doing what it's supposed to do, and then society helping out where it can.
yeah,
Because again, like my solution, like I said, the schools can get together and at least get, they can give them a grant where the kids can have free breakfast and free lunch, or at least free lunch. So at least they in something healthy that they can eat, and then the parents who can afford to feed them all 3 meals can
yeah,
have just one meal to concentrate on.
yeah.
So
Well,
and that hopefully that can happen, and on the
hopefully,
weekend, yeah.
hopefully, we are hopeful.
So
And
government officials, you guys who are listening, because sometimes I get stuff in my inbox, just get the idea. Just the kids need that. That's new. Should be, even when you were showing the picture, when you had a video the other time, I was looking at some of those kids and they were saying their ages. I'm like, wow, that's a small child. I
yeah,
remember being small back home anyways compared to the children over here, because over here they're eating, sometimes the food's not all that healthy either, but at least they look their age.
yeah,
So you can see back home like the hollow eyes and the jawbone and all. So you want to make sure that the government can do that, at least just one meal a day where the parents can afford it, and then the parents can concentrate on just feeding that one meal of the day.
it's necessary. It's necessary. So, you want to give your like closing remark? We Let me see if we can take one more question from our viewers. Uh, okay, the person we're talking about eye. He said, which fruit is best for eye vision?
Carrots. Add some carrots.
So there you go. Get some carrots and begin to start.
Get some
But
carrots.
don't
It's
forget to
carrots
see the
and
doctor.
mango. Yeah, carrots and mango, and that's good.
Don't
But
forget also.
and you want to make sure that also you want to make sure you get your eyes checked too every
Yeah,
year,
yeah,
to make sure, because it's not just vision through your eyes. They can find other diseases too. So you want to make sure you get an eye check. And I don't, and in Liberia, they don't have too many optometrists and ophthalmologists there. So hopefully you have more. I told them before, I said my closing statement would be mainly when it comes to healthcare in there, you don't need to have necessarily big modern hospitals. You can have big hospitals in different counties, but you want to have little clinics. And as I say, you can count all the nurses and all the health practitioners in America, and there still won't be enough to cover everything in Liberia. I know people say, "Oh, Liberian people come here, all they want to do is just be nurses," and just ain't, because when it comes to healthcare, nobody pays attention to that. So it'd be important that just have little clinics, in these little towns, even the smaller towns, you can have one major clinic there. So where the people can go and take their kids there. They will have medications. They'll be able to talk to a health practitioner. It can be a doctor, it can be a PA, it can be an NP, it can be a doctor, and people that can rotate. People coming from America, and also we can go there and also help out. There are people who go there every time. I do support those organizations as well,
yeah,
so and do that and improve the healthcare of the people. When you improve the health of people, when you see the children getting examined every year, and then the doctors and the nurses or nurse practitioners, they will be able to diagnose people, those children who are at high risk, and diagnose them, and if they're malnourished, and have the facilities there where they can go to and get food to be able to eat. Food banks,
yeah.
you have food banks in Liberia, so people can go there and get some food. That should be there. It's just because it's the poverty is rampant. And I know people like to pretend that everything is just a-okay, because if you say anything negative about Liberia, then oh my God, you don't love Liberia. But we talk about
Right.
negative things about America too. We talk about all the
You
negative
gotta
things.
talk about what is not right so
Yeah,
you can find
so you can fix it.
solutions. That's
Yes.
how I see it.
But some people don't like to, it's like, don't say anything. It's like in your family. So if you don't say anything, then nobody would know that it's there, but it's festering and you're not paying attention to it. So it's very important that we do that, and I would say, like I said, I always tell people I'm always willing to, for any kind of consultation, and I do my own show too. So try to play my part, because I know when I was there, I know what I saw, and I know how important it is to have enough healthcare practitioners around to care for our people. So.
Thank you so much, Abby. Thank you. Thank you for joining us. Pastor Rahim, thank you. Thank you for joining us too. We're talking about malnutrition here tonight. And there's a record that shows that right now we got a lot of children in Liberia that are malnourished. So you can start putting some, goodies together so you can send to them. So thank you so much, our viewers. Thank you for joining us. This has been a presentation by the Fortified City International Ministries here in Minnesota. And I'm your humble servant, Pastor Patience, and we will be here again next Thursday on Health Matters. Don't forget to stay safe, get tested if you have to. If you're traveling, get tested. Don't go and spread any virus. If you
And
go to
please make
your
sure, if you're visiting Liberia, please keep an eye on the CDC reports, because you don't want to be there and then they change the traveling
yeah,
rules and you get stuck there. So
yeah.
please make sure you
Right
pay
now
attention
it's
to
like
it.
24 hours before your travel date. I don't
Yes.
know. I don't know, what will change tomorrow, but be on top of your information and get vaccinated. Take your booster shots and do everything you can to stay safe. We want you around so you can fulfill destiny. Okay. Thank you, Fasia, for joining us. Glad to have you. I know you will be here with us next week. And thank you, every one of our contributors. You have been awesome. So, this is Health Matters. Your health matters. Thank you and have a blessed night. Those that are sick, you are healed in the name of Jesus. May the power of the blood of Jesus locate you tonight. Know that God heals, He is the healer. The doctors, they treat, they are there to help us when we need them. God is still God. So, by His straps, you are healed. Good night, and we see you next week, Thursday, same time. God bless you.